So thankfully, the benefits of LASIK tend to be very long-lasting. One of the things that we look at when we evaluate LASIK patients is, has there been any significant change in your prescription over the last year or two? For patients who have had ongoing changes in their prescription, and typically this would be a younger patient, someone in their early 20s whose prescription is still changing, then we typically would recommend waiting for a period of time until we can demonstrate that the prescription is no longer changing. And that's because when we do a treatment, we want to make sure that it's going to give you great long-lasting correction, and we don't want to be aiming at a moving target. As you get into your late 50s, early 60s, there can be some natural changes in your lens inside the eye. So the lens inside the eye, as it matures towards getting a cataract, which often happens in your 60s or early 70s, you have some lens changes that can cause a little shift in your prescription. So some people think that this is LASIK wearing off, and it's really not. LASIK is the reshaping of that front curvature of the eye, the cornea, and these changes that are taking place are actually inside the eye, the lens itself that's changing. So the LASIK isn't wearing off, but you're just having some normal changes that happen in your 50s and 60s. As that occurs, you have the option to either get a LASIK touch-up to try to, mitigate some of the impact of that, or that's often a time where we start talking about refractive lens exchange, which is a more definitive long-term option for patients who are 50 or older for vision correction going forward.